morning, everyone. Welcome to the Ministry of Health press conference. Today we have the Minister of Health, the Honorable Terence Dial Singh, the Minister of National Security, the Honorable Stuart Young, and Dr. Avery Hines, epidemiologist. So we'll start with the Minister of Health.
Thank you. Thank you very much. Are you hearing me? Oh. Hello. Right. Good morning, everyone. Good morning, ladies and gentlemen of the media and the wider listening and viewing public. We have been getting a lot of questions since the issue of COVID-19 started about a particular issue, and that is contact tracing. So I thought it best that today we will deal with how we do contact tracing and how we map that into our GIS system. Because it can't be dealt with at the Prime Minister's press conference. It's a very detailed issue, so we are going to answer all your questions and the country's questions on how we do contact tracing. I just want to give you an update on where we are now with COVID-19. The 10 a.m. report, we have 53 positive cases, and we have tested so far 332 individuals in the country, Trinidad and Tobago. The hotline is up, I am glad to say. So far, over the past 3 days, we have received 23,000 calls. That's right, 23,000 calls. But most importantly, the value of the hotline has been demonstrated in that we have now gotten out of those 23,000 calls 100 genuine referrals to do follow-up testing. And this will help us to prevent community spread. So let me repeat that. 23,000 calls, and we got 100 genuine cases. So I want to relay the importance of the hotline, and anybody who has a genuine reason to call the hotline, please do. Because of the need for the hotline and the success of the hotline, we will be expanding it now from 10 doctors to 18 doctors within a couple of days. So we can handle more calls and get more genuine referrals so we could test them and prevent community spread. I will also like to report that the 4,000 test kits promised by the People's Republic of China is actually in the country this morning. So that boosts our capacity to do more testing, as we spoke at yesterday's press conference. One of the latest cases is a citizen of Trinidad and Tobago who landed in a British Airways flight in A.N. Robertson Airport. I am glad to say that that citizen of Trinidad and Tobago was immediately quarantined at Scarborough General Hospital, and when he became symptomatic, his test was taken, his swabs were taken, and sent to CARFA, which is the national agency for testing in Trinidad and Tobago. His test, as you know, has come back positive, and as per our protocol, which we decided upon months ago, and I specifically remember the CMO talking about this in the first Joint Select Committee, how we will transfer a patient, a citizen of Trinidad and Tobago, from Tobago to Trinidad. That person is going to be transferred by Coast Guard this afternoon in an isolation mode, and will be sent to either Cora or Couva, depending on the symptoms and whether it's a mild, moderate, or severe case. So by this afternoon, that citizen of Trinidad and Tobago will be in Trinidad for further treatment. So those are some of the updates that I have. In moving forward, the conversation in Trinidad and Tobago has to be now to stay at home. Stay at home. And this is where the cries of the Prime Minister, the cries of myself, and I want to just play a video clip for 10 seconds or 15 seconds. This is a video clip of frontline healthcare workers in the United Kingdom telling people that if we are to beat this, we need to stay at home. When you stay at home, especially those 20,000 persons, you will prevent community spread. Let's just have a quick 15-second look at this video, please.
I'm Nick, and we are the Belfast Respiratory Team. We are now in the greatest medical crisis of our lifetime. Stay at home.
I'm Angela, one of the respiratory consultants. This is the crucial time. This is not a rehearsal. You will only have one chance at this. Stay at home.
Thank you very much. I think we have the message. You have frontline healthcare workers in the United Kingdom saying, this is not a rehearsal. This is not a rehearsal. You have the mayor of New York, I think Andrew Cuomo, saying he is not kidding. Ladies and gentlemen, this is not a joke. This is the greatest medical challenge of this generation and probably the last few generations. And the public can help us by doing a simple thing. Stay at home. That is the message I want to leave you with. I will now ask Dr. Avery Hines to come up and talk to the media and talk to the country about what contact tracing is, its importance, and how we use it in real time. Dr. Avery Hines is our technical director at our Epi Division at the Ministry of Health, and he holds a master's in epidemiology from Cambridge University. So he is well qualified to lead the ministry's team as far as contact tracing and testing is concerned.
Thank you, Minister. Good morning to the members of the media. I guess we're not using the stand? Okay. I need the clicker. What I'm going to do this morning is I am going to explain the concepts behind the contact tracing and how those concepts relate to quarantine and how those procedures help to limit spread. What we want to do is we want to get the population to understand the basis of the instruction or the request to remain at home. So, contact tracing, what is it? Why do we do it? How is it done? That's what I'm going to cover, and I'm going to do it relatively quickly. What is a COVID-19 contact? At this point, we're still looking at importation, persons who have come in from places where there are far more COVID-19 cases, and the fact that those people, when they come into country, have been exposed to an environment where COVID-19 is in circulation. So this individual here is a family member, a person who has come in, and the first set of people with whom he is in contact, the people in his household, those are his primary contacts. If somebody from his household then goes out to work, the person from his household then potentially may expose persons at the workplace if the person who is the traveler is carrying COVID-19. So when we ask people to remain at home and to quarantine with their families, the spread or the potential for spread is what we are trying to limit and to reduce. So if person A has a wife or spouse, person B who goes to work, then this entire group of persons is considered secondary contacts. If they have a child that goes to school, the kids in the school would then also be potentially secondary contacts. If person A goes to a religious gathering, much larger numbers of people, these people are also contacts. And anyone who has been exposed, and more so anyone who's been confirmed to be COVID-19 positive, then generates a list of contacts along these lines, different scenarios in which they would have encountered people and created the possibility of transmitting the virus unwittingly, unintentionally, but quite effectively nonetheless. So when we ask people not to leave the house, to quarantine at home, to quarantine with their primary contacts, what we're doing is we're creating a social barrier. That social barrier protects the persons at the workplace or the school of the family members of that initial exposed or potentially positive person, and anyone else to whom the initial imported individual may otherwise have been exposed. It is very important for us to understand how rapidly transmission can be amplified by people not following the instruction to remain in place, to remain at home, and going out and exposing these various kinds of scenarios, these various kinds of workplace, school, religious gathering, other public gathering settings. So contact tracing is a fairly simple process. What we do is we identify persons who were potentially exposed, and we also identify persons who were definitely confirmed with COVID-19, and we ask those individuals with whom they have been in contact. The initial people that we know they'll be in contact with would be their family members, and those persons would be considered primary contacts, and we ask the primary contacts also to quarantine at home, stay away from work, school, gatherings, etc. We then follow up with these persons to find out whether during the course of their exposure or subsequent to their exposure during the course of what we call the incubation period, that 14-day period, whether they have developed any symptoms of respiratory illness. And if they become symptomatic, then they were followed up with regard to getting testing and medical management as needed. So our medical systems are geared towards calling out or making calls to the persons with whom a potential case would have been in contact, notifying them that you may have been exposed to a public health pathogen of interest, and that we are recommending that you remove yourself from gatherings in such a way that you protect your workplace, your school, your church, your whatever. The reason that we're asking people, even outside of these gatherings, to limit their movement and to limit their mingling in the public domain is because although we know that not every cough, sneeze, sniffle, clearing of throat is a COVID-19 case, we are acting on a precautionary principle. And that precautionary principle is if everyone showing any kind of respiratory symptom remove themselves from the ability to mingle and transmit their virus, whichever virus they have, we are slowing the ability of this new virus to make its way through the population. Now, we use technology to make a geographic image of where our contacts may be, and this helps us to understand where we need to allocate resources. So geographic information systems are just really frameworks for gathering information, analyzing them, and managing geographic data, looking at where people actually live and move around, because everything that happens somewhere. Everyone that exists in a given place. So we map the patients and their contacts. We can visualize potential in a given place. So we map the patients and their contacts, we can visualize potential chains of transmission, and we can look at where there may be hot spots, etc., using spatial and temporal analyses, and we can look into the database of persons and query to get additional information. Now, this then helps us with the use of actual data to do evidence-based decision-making. We understand the progression of the virus within the local population, and we can allocate resources strategically. So this is basically dummy data. This is an example of what we would do with this information. So we have a given patient, and we know that this patient had primary contacts that have been in various places. And in this case, we map them in some of the major towns around Trinidad. That primary patient contact then has additional contacts within their workplaces, etc. So you see that how a small number of persons initially in the primary contact set then can make contact very rapidly with a much larger number of persons in a wider geographic span, a wider geographic spread. So it is of paramount importance, just backtracking for a second, that these people aren't then in contact and moving around to expose these people. This is the concept. This is the concept of preventing multiplication, preventing rapid spread. This is what the geographic information system helps us to understand on a country level basis. Why is it essential to stay at home? If we have one person who does not stay at home, takes a taxi, moves around, goes to the supermarket, etc., and it does not, with their respiratory symptoms, and does not self-isolate as we have been recommending, as we have been asking them to do, then there's also the potential that they can expose persons along the way, persons that they don't have contacts for, persons who it is difficult to trace. It makes the contact tracing even more difficult, given the fact that we don't know who they've been exposed to, and this is it's an extremely important point. We need to have people follow the instructions to remain in place, to remain at home, not only for the contacts that you can identify, not only for the people that you do know that you've interacted with, but also to protect the people that you don't know you've interacted with, because this is another layer of potential risk. So in conclusion, we just want to say that we are leveraging all of the cutting-edge geographic information systems and data gathering tools at our disposal to identify, track, and help manage persons that may or may not have COVID-19. And as we ramp up the testing, we are focusing on the healthcare workers who, in their potential lines of work, may be what you call those hidden exposures. And we're making sure that those healthcare workers are taken care of and followed up appropriately with testing in the attempt to prevent any additional community spread. With that, I'd like to conclude.
Thank you. Thank you very much, Dr. Hines. Thank you very much, Dr. Hines. Ladies and gentlemen, we will now have the Minister of National Security to address us.
Thank you very much, Minister Cox, Minister Dial Singh, Dr. Hines. Excellent presentation. Good morning, members of the media, wider viewing and listening public of Trinidad and Tobago. This morning, my task is a simple but an important one, and I think I'd like to just pick up where Dr. Hines has left off. The first point the government would like to make is that all of the measures that we have taken and all of the measures that we've put in place, all of the measures that we've asked you all to pay attention to and listen to and take heed of, as touched on by Dr. Hines and all of our other medical personnel, the Minister of Health over the last few days, in particular the Prime Minister as well, are done to protect the population of Trinidad and Tobago. It is important that you understand that principal concept, that all of these measures are to protect you, the population who are here in Trinidad and Tobago. If anyone can find a way to get through the barriers that we've put up, and these are not police barriers, these are not national security barriers, it comes down to social, personal responsibility barriers. If persons get through those barriers, it compromises the protection that we are attempting to put in place to protect you, the people of Trinidad and Tobago. And in particular, what I'd like to focus on here is our decision to close our borders. Our decision to close our borders was not one that was taken easily or lightly, but it was one that was taken on medical expert advice. Borders across the world globally are being closed, and they're being closed for a reason. Exactly what Dr. Hines just spoke about. The contact spread of this virus is real. Yesterday, I watched a video of someone talking about what happened in South Korea, and that it was one woman in South Korea that led to the spread of 80% of what then took place in South Korea through exactly what Dr. Hines just pointed out to us. So our decision to close our borders was a very considered decision, and one that we intend to uphold, as I said yesterday. This morning, as I looked around the globe, I just want to point out a couple things to us, the population. The Olympics, the largest sporting event every 4 years, is finally going to be delayed, probably until next year. We see what continues to happen in Italy, because they did not, unfortunately, take the types of measures that we have taken earlier. But these measures can be easily defeated and affected by persons who take decisions to breach what we're asking you to do, to stay at home, as Dr. Hines said, unless it's essential, you have to go to work, and to limit your social contact. But back to the borders, you see what's going on in the United States, in the United Kingdom. In the space of 24 hours, last time we were speaking, we were talking about the Prime Minister of United Kingdom shutting down bars. It has now come to do not leave your house unless you have essential business to attend to go to the grocery, to the pharmacy. A country with a population that size taking such a decision is the strictest of measures. We do not want to get there, and it is up to us to take the right personal decisions. The same thing in the United States. You're seeing them now scramble and trying to get medical supplies to different states. You saw them yesterday pleading to the government, the central government, asking them to step in and to stop the price gouging taking place with limited medical supplies. They didn't shut their borders early. We shut ours. These are the reasons why. I found it interesting on the BBC. British travellers stranded in New Zealand and Australia. Quote, travel lockdowns mean hardly any normal flights remain. These are the things taking place across the globe. Singapore have closed their border to all visitors. New Zealand will enter into a full lockdown from the end of the week, when only essential services will be open. This is a global pandemic. This is not about Trinidad and Tobago. Jordan has imposed an indefinite curfew that bans people from leaving their homes under any circumstances. The sensible people in Trinidad and Tobago amongst us are heeding our call. This is why we have shut down our borders, to protect the people who are in Trinidad and Tobago. With every importation of people inside, it expands the risk, exactly as Dr. Hines has just pointed out to us. So now I want to get to the specifics. And now is a call as well. When we ask for everybody to be personally responsible, it must include you, our friends in the media, because you are the ones at the end of the day we're hoping to get the messaging out there. The rest of the population is looking to you, the members of the media. We are looking to you as a government for your assistance in getting the messaging right. I woke up this morning. Of course, we have some citizens who are in different places. All right, let me start with Margarita. So I woke up this morning and saw at 3 o'clock a story in one of the daily newspapers about a Mr. Jagdish Pramsuk, who is described as one of the 70, I don't know how we got to the 70 now, citizens stranded in Margarita, Venezuela, who are pleading to be brought home. The government of Venezuela took a very early decision to shut not only their borders, but to start asking people to stay indoors. There is a reason for that. The same reason Dr. Hines was just pointing out. And this gentleman is using the media here today to sell a story as to why he should be allowed in, why he should be the one to break the borders and to be permitted back into Trinidad and Tobago. What he did not tell you is that he's a resident of Venezuela. What he did not say in 2010 is when he applied for his passport in Caracas, Venezuela, under residency, and where he lived, it was Venezuela. What he didn't tell you is he has his Venezuelan ID card. These are the types of things that are irresponsible. We have shut our borders to protect all of you here, to protect all of our citizens in Trinidad. I understand that people are going to be running to the members of the media. That's how it goes. They're going to be giving you all stories for you to run with. The government is going to hold fast to protect the rest of the population. That's the first one. The second one is the unfortunate 35 citizens who are now in Barbados. You all would recall some time ago the government announced a decision. We are locking down our borders to non-nationals. Non-nationals, you can't come in. That is one step. That is a clear signal for our nationals. If you're outside, hurry up and get home. It's a clear signal that we're limiting now the same contact spread that Dr. I.A.N spoke about. It doesn't mean we're going to leave our borders open indefinitely. The only way a country has a chance to beat this and to keep the curve down is to take some of the difficult decisions and the measures that we have done on the advice of our medical experts, our Minister of Health, with the Minister of National Security, Prime Minister, and the rest of the Cabinet. So when we shut our borders off now to nationals, it is not something that we wanted to do. It's not something that we take pleasure in doing. But the reason for it is to protect you, the remaining population in Trinidad and Tobago. And every person that we allow in now presents a risk potentially. We announced no non-nationals in, when was it, last week sometime. There were still available flights all over the world to make your way back. Yesterday, I spoke to the government of Barbados. I spoke to Prime Minister Motley and her Attorney General, and it was a very CARICOM conversation. And I emphasized what our position was as they understood. I haven't seen it reported anywhere that Barbados already has in place a mandatory, we haven't put in place a mandatory self-quarantine or quarantine period of 14 days. The Prime Minister of Barbados and the Attorney General point out Barbados has a mandatory self-quarantine or quarantine by the state for 14 days. That is their attempt to try and protect their population. They understand what is taking place. We went a step further and we closed our borders. Not because we want to keep any Trinidadian out. That is not the reason. It is to protect those who are within our borders now. I have to say, I found it a little disappointing to receive a short while ago a question from one of people in the media asking me, these people in Barbados, they've obviously been in contact with them. They put in a hotel. That was part of my discussion yesterday with the Prime Minister of Barbados and the Attorney General of Barbados. They said they would do what they can to make our people comfortable. They have to apply to the strictures of the 14-day mandatory quarantine in Barbados. I am being asked now today by the media whether we in Trinidad and Tobago are going to foot the bill for these people at a hotel in Barbados. The population of Trinidad and Tobago understands what we're faced with. The population of Trinidad and Tobago understands that we did not command or ask anyone to leave Trinidad and Tobago and not make their way back here. Everybody took personal decisions. The people who have gone out and weren't able to make their way back in, we feel empathy towards you. We honestly do. But the duty of the government, which we are very clear about, is to protect those who are here in Trinidad and Tobago and to uphold our decision to close the border. It was also just brought to my attention a short while ago, and the Ministry of Health, in keeping with their promise to the nation, put out their press release giving us the statistics and the information as to what is happening with COVID-19. We just got a presentation from Dr. I.A.N explaining to us about primary contact. As we were sitting here preparing for this conference, a media house reading the latest release from the Ministry of Health, where they say the second case that was confirmed yesterday was someone who had primary contact. What that means is the imported person came back. It is a family member in the household. That is primary contact. Rush out with headlines. And these are the types of headlines that can create panic. And what we need to avoid. Splashing everywhere. Community spread starts in Trinidad and Tobago. First case of community spread. The use of technical terms is very important at this stage, people. The government is doing everything it possibly can in a most responsible manner to provide the population with the information. The release said primary contact. Primary contact means within household, within family. It does not mean community spread. So for the media to rush out and try this community spread, and one must ask why. We're all in this together. We need the media. We are asking you all, work with us. Let us be responsible, because now is when the media will help the rest of the population to get the right information. And that information from the government's perspective continues to come from the Ministry of Health and the Ministry of Communication, who are doing a great job. So please join with us. Be part of the personal social responsibility that we're asking for. We are not going to allow the exemptions to the borders. I want to touch on the last thing that the Prime Minister said, the Honourable Prime Minister said yesterday, when he talked about the returning and the repatriation of our students at UWI in Mona and in Cave. In planning or shutdown of the borders, that was always part of our process. The Prime Minister spoke, the Chair of CARICOM, we are putting those things in place. They have students from Barbados, Jamaica here, etc., and we're going to do that. But it has to be done in strictures with the medical experts overlooking it. That was always a condition of us shutting our borders. It is not an exemption that is now open for everybody else. For unfortunately our nationals who are spread all over the globe, our message to you, stay put, be safe, be responsible wherever you are. But this government is resolute that we will continue to protect the population of Trinidad and Tobago that are here by upholding the measures that we've put in place. The Minister of Health touched on our receipt this morning of the 4,000 kits, testing kits for COVID-19 from the People's Republic of China. We also this morning received the 15 thermal scanners that they've promised. The national security will position in certain key places throughout Trinidad and Tobago, because our cargoes, we still have to be able to receive cargo via air and via sea, and there's still that industry taking place. So they will be positioned at our ports and anywhere else that the Ministry of Health would like us to position those 15 thermal kits. We thank the People's Republic of China. I just want to end this part of my contribution by saying the government will continue to do all it has to in very difficult times and circumstances in a global pandemic. I think that point sometimes is lost on us, of when you look and you see what is taking place globally. Fortunately, so far, and it can change very, very quickly, as we saw with the 70 people who were on the cruise ship that came in, immediately that takes up your resources. So it can change very rapidly, which is why we shut down our borders. Please work with the government, who are going to do everything we can, balancing our resources, balancing our respect for people and the population, with a clear mandate that we have to protect the population that remain in Trinidad and Tobago, and we will do what we have to do to achieve that. So it comes back down. We've been receiving reports. I have received a bundle. I'm sure I have the CMO, the Minister of Health, this morning, about people all over. The CMO told us yesterday about 19,000 people coming in the last 3 days. We've asked you to self-quarantine. I'm receiving reports of persons that came in and they're not self-quarantining. Exactly as Dr. I.A.N showed us just now. Even when you self-quarantine, your family members as well. Stay put, as you heard the Prime Minister. Increase your personal hygiene in your space. But please, if you've been asked to self-quarantine, we've allowed you back in the country. We didn't go the mandatory quarantine. Follow it, as you've just seen how quickly one person can spread that amongst us. As this far, and it will change, I'm sure, but we're hoping it doesn't. There's no community spread. So please, everyone, exercise your social responsibility, the social distancing. People who've returned from abroad, stop mingling. Stay put, stay home. I've looked at some of the cries and the pleas from Downing Street by the Prime Minister of the UK. Unfortunately, our Prime Minister was ahead of those decisions. But to watch him, the Prime Minister of the United Kingdom, yesterday, telling his country, stay at home, only go out for essentials. It brought a chill. So people, the government's message is, please be socially responsible. Please help us to protect you, because that's all that we're trying to do. Thank you.
Thank you very much, Mr. Young. Ladies and gentlemen, we are open for questions. Please identify yourself.
Good morning, Crystal Wilson, TTT Limited. We understand the call for people to stay home. Public servants are asking, what about them? What's in place for them? Other question is regarding daycare facilities. I understand some of them are still in operation. Does it matter the number of children, or are you all asking that they not function for the time being?
With respect to the first question, government ministries, so for example, the Ministry of National Security, and I know some others, have already begun addressing that question. So at this stage, it is about social distancing in workplaces, not only government ministries. We have started rotation of staff in other areas of national security, immigration. You would have heard some of the measures we've put in place yesterday to stop the influx of the public into office spaces. The Attorney General, in the passage of legislation last week, we also passed legislation, for example, people at licensing office, people at the company's registry. With respect to our public servants and workers, they are not left out. The government continues to take the advice from the Ministry of Health and our medical experts as to what are some of the things that are to be implemented that can minimize. We still need to function. And that is what we're trying to do. The essential services continue to be needed. We recognize as well, especially at this point in time, with persons who may be losing their jobs, etc., that the government's role is increased, that we need to have that outreach in the social aspects of helping persons. So we will continue to do all that can. I was pleased this morning to see that the Minister of Finance had sent to the Prime Minister and myself, we had a discussion over the weekend about NLCB lotto outlets. And they sent out a pamphlet, and they've put markers on the ground, or they're supposed to outside for people to know where they can stand in line. So these are some of the things that are taking place, and it just comes down to common sense, listening to our medical experts at the end of the day. But it is subject to change. This thing changes, as you all would have realized by now.
Okay, on the issue of nurseries and children, whenever we speak about COVID, you will realize we always say at this time, because more and more information comes up. So when COVID first started, the theory was that young people, children and babies, and CMO could correct me, will not be so adversely affected. In other words, they will not get violently ill, they may not die. That led to a ton of irresponsible behavior by young people across the world, because young people in their 20s, 30s, spring break in university felt, well, I am immune, I will not get it. Two things changed. One, the epidemiology over the past month or 2 to 3 weeks blew that theory out of the water. What you are seeing now is more and more young people coming down with it, and coming down with it severely. Okay? So, in treating with COVID, it is better to assume we don't know and stay home than to think we know and go out into the public domain. Right now, the current thinking is that babies and young children may survive this well. But like the young people, suppose we get data in 2 to 3 weeks' time, which shows that babies are starting to die. What do we do then? We can't roll back that clock. So we are advising young babies and children should not, as far as possible, be intermingling in a nursery, in a daycare, because whilst the current thinking is those young children or babies may not get seriously ill, they can be carriers, and they will take it home, pass it on to their mother who has to breastfeed them, because you can't have social distancing between a mother and a baby. The father has to bathe that child, you can't have social distancing there. So children and babies have to be treated as a special category, because we simply don't know at this point, as we did not know that young adults in their 20s, 30s, and 40s would succumb to this now when they were not succumbing to it a month ago. So prevention is better than cure. The message I played from the BBC, stay home. Staying home and isolating yourself, unless you have to go out for something that is absolutely essential, is the only way that Trinidad and Tobago will remain below the curve in this global pandemic. This is not a rehearsal. This is not a joke.
Just to touch on what the Minister of Health just said there, because I know the next question will be, well, should everyone stay at home? Workplaces are taking their own decisions in their own spaces, listening to the medical expert advice. So our essential services continue to work, or police or healthcare, thank you. We can't emphasize enough the thanks to our frontline people. Workplaces will continue to take decisions. It is going to change over time, but if we don't beat the curve now, there's a potential for, you see what's happening in the UK, US, Italy, and these places. Right now, we're in a good place. The only way we're going to stay in that good place is every single person taking that personal social responsibility decision every step of the way.
Hi, good morning, Minister Dial Singh. Shane Superville from the Newsday newspaper.
Yes.
You raised a very important issue with the changing patterns and epidemiology of the disease. With that in mind, I want to ask you two questions. One, without getting into too many details on the identities of the infected so far, can you give us a breakdown or a cross-section on the ages, genders, general background and conditions at this time? That's one. And two, in terms of patient 0, our first recorded case so far, can you also give us an update on his condition in particular and what we would have learned so far on when the virus has ceased, or when someone has been cured, so to speak?
So we dealt with that yesterday, but I think the CMO will deal with it again. No problem.
Good morning. So just a clinical update as of this morning. We have 52 hospital patients, 4 at Cora, all stable, 48 at Cuba. There's 1 ICU patient, 7 in HDU, and 40 patients are doing very well. So that's the update as of this morning. Yesterday we would have given an update as well, similarly. In terms of the first patient, I did say yesterday that he was doing well. We took a sample from him to determine if he had his first negative. We didn't get the results back as yet. If he has a first negative, we repeat that in 24 hours. If he has a second negative, he can actually be discharged though. So we will know that in a matter of course.
Right. Good morning, Derek Atcham.
So I think I answered that yesterday as well. So we were afterwards. So we're in the process of actually compiling the entire list, looking at trends. We are looking to international trends as well in terms of disease, because they have much larger numbers than we have. And when you look at diseases, the larger the sample gets, the conclusions that you draw from the samples are more relevant. They are more scientifically applicable. So our numbers are small, but we are starting to develop the trends, look at the people that are being ill, which ones are severe, which ones are not, that sort of thing. But so far it is mirroring what is happening in the international community.
Good morning, Derek Atcham from GM Guardian Media. Dr. Hines, can you define for us what is community spread, since we seem to have gotten it wrong this morning?
Good question.
Okay, thank you. That's an excellent question. Now, let's just backtrack for a second. When we trace contacts, we have one individual who we have as a confirmed case or a suspect case, and we are looking at your contacts. As long as we can identify a chain of transmission from one person through primary, secondary, tertiary, etc. contacts, then we know where the virus has originated and how it got to the people who turn up next. Community spread is where we start having cases where we do not know how you were exposed. You did not have a travel history, you did not have a known contact history, and somewhere in there is a missing link between the importation that would have had to happen and the case that shows up in front of us. So spread within an identified chain of contact is not community spread. community spread is when we now have a situation where, like as in Italy, as in the other countries that we've been looking at, they don't know where all of the cases are coming from, but they know that it's clearly being passed from person to person within the population, and that's not the stage that we're at this point in time.
Can anyone give us some information in terms of the 53 persons that are currently hospitalized, in terms of how many are imported? How many are primary? All are imported.
All are imported.
Well, we have received information from Guardian Media that one person, I'll use the initials AB, from Pity Valley, a tour operator, is included among the 53. He has no travel history, according to what relatives are telling us, which may be wrong. And he had contact with someone a traveler from Malaysia who entered the country and stayed at his home. I mean, this is what is being told to us, so we're just seeking clarification on behalf of the public.
Yeah, so first of all, I don't know who the patient is you're talking about, but this morning last night we would have had the first case that was not directly linked to travel. And that's what they have discussed as a primary contact, so someone living in close proximity to a case that was imported. None of the other cases, and the way we get our history is from the primary medical practitioner who sees the person, would ask specific questions based on travel, etc., to determine if they think it is imported or not. That actually goes along with their test request to Trinidad Public Health Lab and onward to CAFA. And CAFA is now actually sending me back something saying imported or not, based on what they find. So it's being validated at many levels. So I think that's just speculative at this point, but all our cases that we have reported, aside from the last one, which was a primary contact, has been directly imported at this time.
Whilst we're waiting on the next question, despite what we just said, what we said yesterday, what the Prime Minister said, I still have the 35 people in Barbados. It appears to be sending messages and spreading messages everywhere. Our position is very clear. We announced on Saturday last that we were closing our borders as of midnight on Sunday, and that we would be closing our borders now. Additionally, they were already closed to non-nationals. We were closing them to nationals. The people who got on the flight to Barbados took that risk of getting to Barbados after the government announced its measures, not that we would not be allowing persons on our borders from midnight last night. They flew yesterday. Yesterday was Monday, when the borders were already closed. I have explained as best as I can, with hopefully an adequate degree of clarity and certainty, the reason we have closed our borders is to protect all of you here, all of the people who are already in Trinidad and Tobago. So no amount of pleading and coming from all different directions is going to assist, because once you allow one person to break that barrier, then where do you stop? Where does it stop? What is the difference between the 35 and the others who may be in other parts of the world? We are not granting exemption. They are comfortable in a hotel, abiding by, and they should have known before they got on the plane from London to Barbados that Barbados had a mandatory quarantine. We are not opening our borders. Thank you.
The details regarding pandemic leave and accessing pandemic leave, have those issues been finalized as yet? Also, maybe the Minister of National Security can confirm for us the demerit system. Is that on hold come April 1st?
The motor vehicle demerit system?
Correct.
It sounds like you want to attend FNGP later this afternoon. Those two notes came before Cabinet and are currently before the Finance and General Purposes Committee of Cabinet, which we will be meeting on this afternoon. Understand that at this stage, the government's priority really is to protect the people. Our priority has to be at this stage dealing with our response to COVID-19. So a lot is going to be put on hold because it is not business as usual. The pandemic leave is one of the items that will be discussed this afternoon. The demerit system is also there. I guess the conversation can be, and I don't want to preempt it, when it will be implemented and kicked in.
I have a question. question online and to the Minister of National Security. Persons are seeing that people are not adhering to what is being told to them. They are asking if a state of emergency is the next step.
This government is very measured. Hopefully by now the population, as I believe they have appreciated and understood, we take our decisions very, very carefully and considering a number of factors. At this stage, that is not on our priority list of discussion, but one never knows if we may end up there. The medical experts very early o'clock gave us a 3-tiered system. That will be one of the inputs, but we're not there yet. You heard the Prime Minister say that clearly yesterday, and nothing has changed between him yesterday and today. The government will continue to act responsibly, balancing what we need to balance, but clear that we need to protect the people of Trinidad and Tobago.
Hi, good day. This question is for Minister Young, Mark Bassan from Guardian Media Limited. Minister Young, I know you spoke about responsibility of the media to convey the proper information in the public domain for,
as best as you
citizens. And so doing, you also mentioned the issue of Barbados and the 35 nationals there. However, you also said that there might have been some information that was transmitted in the media in relation to that story. However, we were not in any way communicated by the Ministry of National Security that in some measure would have reached out to the Prime Minister of Barbados and made some kind of arrangements to have those nationals basically taken care of while they're there. And in the same measure that you want us to also transmit proper information, maybe I'm just saying that maybe the communications could also, the lines could also be open on that side, where maybe a release of some sort yesterday afternoon indicating such would have helped to balance the story in some measure.
Thanks, Mr. Bassan. Yesterday afternoon, there was a press conference headed by the Prime Minister for over 2 hours.
2.5.
2.5 hours, the Minister of Health reminded me, and Minister of Communication before we came here. There was a lot of information flowing there. At that stage, that was not a topic that needed to be addressed. The message from the government is our borders are closed. The message from our government is that the reason that we've shut our borders, even to nationals, is to protect everyone here. And that applies to everyone. And that was a clear messaging. I expect persons who are outside to reach out to the members of the media, and I have absolutely no qualms with that whatsoever. That is par for the course. It is how we then deal with it, how we then get our messaging across. And the media has been good.
I'm just saying that you need at least to have to carry a balanced story, and you're saying that the media probably didn't check.
Well, I think what spurned all of this, if we're being honest, is you had, of course, it was live. It was the issue in Barbados yesterday. So I think people who are following what's going on in the region would have seen an interview, I think, with the Attorney General, Mr. Marshall of Barbados, and he was very clear in what he said. So, of course, the next step after that is what is the government's position, and that is why, to be honest, we moved our press conference. We were thinking of having it at 2 o'clock this afternoon to 11 o'clock this morning to come and provide the information. So the information is provided. There is absolutely nothing that we don't want to provide, so we moved our press conference today to 11 for me to address not only that issue, which we knew would be an issue, but also to provide you all with the opportunity to ask the questions. Thank you.
And which whether Minister of Health or Dr. I.A.N or the CMO can answer this one. But now that we have received the 4,000 additional testing kits from the People's Republic of China, though we know it's not unlimited, there's a finite number, how wide is the testing going to be now in terms of secondary contacts?
Okay, so yesterday I gave a whole 10-minute thesis of it, so I will repeat it. It's not a problem. So I have it here. CARFA will be testing all samples that fit the criteria for potential exposure. In addition to that, we will now have a special capacity to test healthcare workers who are on the front line based on their exposure. But, as I said yesterday, all healthcare workers like in Cora and Couva are fully outfitted with PPE, so their exposure is extremely limited. We are going to start to test primary and secondary contacts who are quarantined. As Dr. Hines has said, once we trace them, they will be quarantined. They will now be sampled and tested once they develop symptoms, and cases of severe acute respiratory illness or SARI in all hospitals will be tested. Once anybody meets the criteria based on WHO's case definition, they will be tested. So testing is going to be ramped up. We are also bringing online, as we said yesterday, additional testing capacity at 2 locations. Eric Williams Medical Sciences Complex, where there's a PCR machine, and we'll be installing a new PCR machine which came in recently, which was ordered even before COVID, at the Trinidad Public Health Lab. So in the space of a few weeks, first of all, we'll get Eric Williams up, then we will get TPHL up. These other 2 labs, will be certified by CARFA to do the PCR testing. In another 4 to 6 weeks, a 4th PCR machine will be installed in Trinidad and Tobago, which comes from the International Atomic Energy Agency, IAEA, to which we are a signatory. So between the next week to the next month and a half to 2 months, you are going to have a rollout of testing capacity from 1 lab at CARFA, 2nd lab at Eric Williams quite soon, 3rd lab at TPHL in a couple of weeks, and a 4th lab in a matter of maybe a month and a half to 2 months. So our capacity to test is going to be significantly enhanced.
Thank you very much, ladies and gentlemen.
Yeah, I think this question has an inherent, there's a degree of misinformation that will go out. Now, Trinidad and Tobago has always been testing according to the WHO guideline from day one. And we have always been testing enough. So we have 1 case, as Dr. Hines would have shown, there was a certain X amount of primary and secondary contacts, which we would have been testing from the start to ensure that if they become symptomatic, we test to make sure that they're negative. So that has always been the case. As you go from 1 case to 20 cases to 50 cases to 100 cases, obviously you will have more secondary contacts, you will have more tertiary contacts. Our capacity has to grow to actually preempt that increase so that we are able to test in the same way that we did for the first case for all 100 cases. And that is the reason we are ramping up. Not because we are expanding the definition. We are ramping up because the number of cases are increasing.
And one of the other things I'd like to announce, seeing that we're on this topic, is yesterday, very early, the Honorable Prime Minister gave the instructions, in addition to the 4,000 we received, and we're getting a few thousand more, for me to place an order for 10,000 kits. And that's not because we're expecting anything, which is because, exactly as the Minister of Health and the CMO have been telling us all along, we just want to stay ahead. The success of our management of this is us preempting and just making sure, and of course, we don't know how the world will unfold. So we have also placed an order for 10,000 more testing kits.
Okay, we'll have a final question.
Hi, good day, Minister Diyal Singh. I don't know if either you or the Chief Medical Officer may be able to answer this, but I know during his address yesterday, the Prime Minister would have said it may be difficult in certain situations for self-quarantine to be possible. There may be households that only have 1 room available for self-quarantine. In light of this, I don't know if it would have come up as a consideration to open public centers like community centers and so on for self-quarantine if that ever becomes necessary.
Okay, so it has been considered at the level of my interministerial committee. So we have tiers of self-quarantine. So what we have looked at, of course, through ODPM as well as the regional corporations, is increasing the capacity as we have more and more people in self-quarantine so that we can respond. I think the Prime Minister said it well yesterday when he said if you're in a small household, we do best as we can in terms of hygiene. but we are quarantining as families in those circumstances. If they have the capability to use a second space in your house to isolate someone, that is good. But if you can't do that, we're quarantining as a family. Okay?
Dr. Parsam, can I be permitted one more question?
Is Donna in charge?
There was a New York Times article recently talking about ventilation in public workspaces and where there have been infections and so on carried through ventilation systems. Maybe even if the Minister of Health can also address that. Is there any kind of in terms of the ventilation of filters that workspaces can look at, in case there is a suspected case in an office space where there's the refiltration of air and so on?
So basically, as far as we know at this point, it is still spread by droplet infection, which does not go, it is more easily transmitted to hard surfaces. So tables, doorknobs, those kinds of things are the bigger concern at this point in time. However, environmental controls are being looked at through our health and safety departments. And if we do have suspected cases in the workplace, we advise them directly as to how to sanitize, as the need be.
Thank you all very much.
Thank you very much.
Well done. Yeah, but he's not inside.